Okay, welcome everybody and good afternoon. Thank you so much for joining us for today's presentation. Fauquier Chamber and Fauquier Health are really excited to be able to have the opportunity to partner up together to provide some vital education surrounding the COVID-19 vaccinations. I know it's a very exciting time in our community. I want to take a moment just to introduce myself. I am Sarah Cubbage. I am the Public Information Officer with Fauquier Health. I know personally I'm really excited to be here today, and we really hope that you find this information helpful and encouraging. And personally, I know that we all want to get back to a more normal state, and honestly, this vaccine is going to be the way that we do that. So during this presentation, your mic will be muted just to ensure that we can hear our presenters clearly today. And if you do have any questions, again, as a reminder, you can send them directly through the chat feature. Just make sure that you choose the Fauquier Chamber contact when you go to send those questions over. And given our time constraints today, we are going to work to address any of those questions as we can, but we will likely be publishing a frequently asked questions document after today's meeting to share community-wide, so be on the lookout for that. I would like to actually go ahead and introduce you to Mary Ann Clyde. She is the chair of board with Fauquier Chamber. Her and then Chad Melton, CEO with Fauquier Health, they are joining us to help kick us off today. Mary Ann, take it away.
Thank you, Sarah. I have to say, I am so excited about this particular presentation today. And I want to thank Fauquier Health and Chad Melton and you, Sarah, for generously agreeing to really host this really important meeting. It's a topic that's of greatest interest to everybody right now. And no matter how you might feel about the vaccination, absolutely, this release of the vaccination is vital to getting our community back to work and the whole country back to work. So I just want to thank each one of you for being here today and being a conscientious citizen and getting the most updated information. And so here I'd like to introduce to you the CEO of Fauquier Health, Chad Melton. Back to you.
All right, I don't know, Sarah, hopefully that you can hear me and the team can hear me that's on the phone call. What a long year 2020 was, but such a great time to really pull together as a team and as a community. We couldn't do this presentation today without thanking tons and tons of people, and I could have a laundry list of people to thank, but really the VDH with April, Dr. Karchner, Daniel, the whole entire team, for pulling us together and rallying us as a community to do the right thing, to mask up, to wash our hands. We really appreciate the education and support that you've given us. And then internally, Amy Kaminsky has worked so hard, our employee health nurse and infection prevention with Kathy and the team in our quality department, to make sure that we could continue to provide services to the community. But the vaccine is an exciting time period for us, and also one that creates additional challenges. I'll say that before we jump into the vaccine is that there's still people out there who think that COVID is not real. We can tell you by being on this side of it, on the healthcare side, that COVID is 100% real. When you see people dying and suffering every single day, when you see the hospitals in Northern Virginia being down to 20 ICU beds, it's something that we have to take serious. And so that's why we're so excited to start really talking about getting out there and getting vaccinated and making sure that we can be there to provide support. So we appreciate Mary Ann and the Chamber. We appreciate our community for rallying behind us in such a difficult time. And now we're off to 2021 to more exciting things. And so we look forward to the team presenting today to educate you on the vaccine, and we will send it back to Sarah.
Wonderful. Thank you both so much for those opening remarks. Really appreciate it. I can't attest enough to all the great work that is being done at the local level. within the facility and within the community. So I am really excited to go ahead and turn it over now to Amy Kaminsky. I want to introduce her. She is actually our vaccine coordinator at Fauquier Health. And then also we're going to have a presentation today brought to you by Gary Matthews, our Director of Pharmacy. Amy, I'm going to go ahead and kick it back over to you now. Okay, give us just one moment trying to figure out how to get this unmuted here.
Can you hear me?
We can hear you. Perfect.
I'm so sorry. Let me start over. I'm so excited to be here today. We just finished wrapping up another vaccine clinic session this morning, just about 15 minutes ago. So we're really busy, but really happy and very happy to be here today and share some information with you. So I'd like to start this off with saying that what we're presenting today is what we know today. And that's really important because we did a town hall with our internal employees about a month ago, probably less than a month ago. And already we have so much more knowledge and information than we did 3 weeks ago. So we will continue to update you, but our vaccine allocation and distribution is directed by the Virginia Department of Health. And this distribution is progressing and evolving at the direction of VDH. We have very specific guidelines, and we will continue to update you as more info becomes available. So just to give you a little bit of background, the daily number of COVID-19 cases are surpassing previous records. To date, over 250,000 Americans have died from COVID-19. And probably since this slide was created, that number is probably way up there even more. So Pfizer and Moderna were the two companies that filed for the FDA emergency use authorization. You'll hear it referred to as EUA a lot of times. Both received approval. Pfizer received it about a week before Moderna. So at Fauquier, we have really been investing a lot of time and resource into our vaccination effort. We know that this is of utmost importance. We also know that just because you have an availability of vaccines, it doesn't guarantee that everyone's going to go get vaccinated. So in October of 2020, which seems like a lifetime ago, but really wasn't that long ago, research showed that only around half of the U.S. population said that they definitely or probably would get the vaccine. So at Fauquier Health, we know that by getting vaccinated, that means that we are focused on protecting our patients and ourselves so that we can continue to provide care. We are leading by example to help speed up the end of this COVID-19 pandemic. We know that if our employees are COVID positive, they can't be at work. If our employees are worried because they have household members that have tested positive, they may not be able to be at work. If our frontline staff can't be at work, then we're worried about patient safety. So we want everyone to be vaccinated and be healthy and be able to come to work and take care of our patients. So when you poll people and you ask them, well, why would you not get the vaccine? These are their answers. 47% are worried about the vaccine side effects. 22% are worried about getting infected from the vaccine. 9% don't think the vaccines are that effective. 7% of people don't like shots or needles. And 6% don't believe that coronavirus is that serious. So for Virginia, what they did is they created a prioritization guidance as every other state did. So we actually had a healthcare worker COVID-19 vaccination prioritization guidance. So this was developed, pre-getting the vaccine, but it was rapidly put together, but a lot of thought was put into it. So when we talk about phase 1A, I know everyone hears about phase 1A, phase 1B, phase 1C. Phase 1A actually has many subsets below it. So if you look on here, phase 1A is high-risk healthcare workers and EMS with direct patient exposure. And then you look down and you have all these subsets. So go ahead and flip to the next slide because it actually continues on. And I'm not expecting you to be able to read all this, but I just want to explain that in the beginning, we were actually having to start with the first subset to say who gets the vaccine first, because in the beginning, we weren't sure how much we were going to get. We weren't sure how often we were going to get it. We weren't sure who was going to take it if we offered it. So go ahead and flip to the next slide. So in our very first round of phase 1A, we had to kind of go through our hospital and say, who falls into this category? So immediately right off the bat, ED staff, ICU staff, our COVID unit staff, all of our respiratory therapists, any providers that rounded on COVID patients, any of our lab personnel that come into contact with COVID positive or suspected COVID positive patients, our family birthing center, and our surgical services. So originally when we got the vaccine, that was our number one goal. We've got to get this staff vaccinated as quickly as possible. And that's what we did. Fortunately, we were very fortunate that we were able to get enough vaccine that we were quickly able to expand our efforts to vaccinate all healthcare workers within phase 1A. So that was just a blessing. I thought we were going to have to go more slowly through the subsets, but because of our vaccination efforts and the amount of vaccine that we were able to receive from the state, we were able to quickly expand through all of phase 1A. So at the bottom of the slide, it says, to date, Fauquier Health has administered over 18 COVID-19 doses. Well, since that slide was updated yesterday, our new numbers are we're up to 1,190 doses. We have administered over 570 doses of Moderna and over 620 doses of Pfizer. So as you can see, this is rapidly changing, but in a good direction. All right, we have our long-term care and our assisted living facility. So our long-term care is Fauquier Health Rehab and Nursing Center, also known as FRONC, or to some of you, maybe Warrington Overlook. And then we have the Villa at Cecil Meadows. Both of them are, have partnered with pharmacies through the federal government to be able to target their population and their long-term care residents. And we also, because we had enough vaccine, we were able to, anyone that worked at the Villa or worked at FRONC that said, hey, we're not getting our vaccine for another week, we said, come on over, we'll vaccinate you. So we're really excited that most of that population is almost done being vaccinated as well. So when you look at the vaccine, projections show that only approximately 30% of healthcare will elect to be vaccinated. That was kind of the number I had in my head. It wasn't the number that I was hoping for, and I'm really excited to say I can't give you a definite number because we literally just finished up with the clinic, a long clinic yesterday and one this morning, but I know we're well over 50% of our healthcare workers have been vaccinated, so I'm just excited that we're exceeding what the projections were. We have had both vaccinations, Pfizer and Moderna. They both are a two-part series. So Pfizer is you get your vaccination and the second dose is to be administered 21 days after the first dose. And Moderna, second dose is to be administered 28 days after the first dose. And it's very important to note that the second dose needs to come from the same manufacturer as the first dose. So if you get Pfizer as your first dose, Pfizer needs to be your second dose. If you get Moderna as your first dose, Moderna needs to be your second dose. And so now I am going to kick it over to my coworker, Gary, to let him talk to you a little bit about the actual vaccine. Laura.
Hey, good afternoon, everybody. As far as these vaccines go, their side effects really haven't shown to be any different than the other vaccines that you might get, like the flu vaccine. There's the usual occasional fever, chills, and mostly a sore arm. And in fact, I think Amy's going to mention it a little bit later. When you get your vaccine now, you'll be offered the opportunity to participate in a CDC real-time program called vSafe, where they'll monitor how you're doing after you receive the vaccine on your phone. They'll check in with you 2 or 3 times, or once a day for 2 or 3 days, and then once a week afterwards until you get your both vaccinations. But so far, with both the Pfizer and the Moderna vaccines, it's been going very well, and we really haven't had any serious side effects. There are some common concerns with receiving the vaccine. You cannot get COVID-19 from this vaccine. This vaccine is different than older vaccines that you might have received in the past. Vaccines that have been out there for the most part in the past are developed with a biological process where it's either a weakened pathogen or an activated pathogen or an antigen from the pathogen that's used in the vaccine to trigger your body's immune response. These are mRNA or messenger RNA vaccines that they are incorporated in the outer wall of your body cells and your deltoid muscle in your arm. And basically, it makes your cells develop a harmless piece of what's known as a spike protein or an antigen, and that spike protein migrates to the surface of your cell, and that's what triggers your body's immune response. As far as effectiveness goes, there was a goal of 50% effectiveness when these vaccines were developed, and you all have heard that the Pfizer vaccine is 95% effective, and the Moderna vaccine is also 95% effective. So they seem to be working very well, and they did those tests in over 40,000 people. So those are pretty big drug studies, as drug studies go. We talked about how the vaccines work. The other issue is who should get a vaccine and who shouldn't get the vaccine. And initially, when the vaccines came out, there was concern that maybe pregnant and lactating women should not get the vaccine. They have discussed this with the American College of Obstetricians and Gynecologists, and their advisory board recommends that women in those circumstances discuss it with their provider, but they really don't see it as an automatic contraindication to getting the vaccine. The only other thing is there's also whether or not you've had a COVID-19 infection before the vaccine comes out or between your first and second doses. And basically they're saying that if you've had a COVID vaccine infection, you should wait 90 days, that you have enough immunity from that infection to last you 90 days until you would need to get vaccinated. And again, if you should happen to develop an infection between the first and second vaccine, that you should also wait 90 days before you get your second vaccination. But you would not need to start over again. So I think that pretty much covers the part that Amy wanted me to talk with you all about, and I will let her pick up from there. Thanks.
Thanks, Gary. So I wanted to pull some information from CDC, and this is not everything that obviously that's on the CDC. So I'm going to encourage everyone that's on this call and anyone that you talk to please go to the CDC website and read and educate yourself as much as you can. But I wanted to pull some things that I get a lot of questions about, so I thought maybe there might be some people in this audience that have this question. So I get a lot of phone calls, should I get the vaccine, should I not, in a lot of different scenarios. So one reason that would be a reason to not get the vaccine is if you've had a severe allergic reaction to a COVID-19 vaccine. So let me just read this and then I'll explain it. So CDC has learned of reports that some people have experienced severe allergic reactions, also known as anaphylaxis, after getting a COVID-19 vaccine. As an example, an allergic reaction is considered severe when a person needs to be treated with epinephrine or an EpiPen, or if they must go to the hospital. So this tells you if you've had a severe allergic reaction to any ingredient in an mRNA COVID-19 vaccine, you should not get either of the vaccines, which makes perfect sense. So I'm assuming that most people don't know if they're going to have an allergic reaction to this vaccine because they've never had an mRNA vaccine. I will tell you, though, if you had an anaphylactic reaction to a vaccine in the past, that you really need to discuss with your physician, because it's probably not a good idea to get this vaccine if you're going to have an anaphylactic reaction. But that would be something for you and your physician to discuss. Now, let's say you get your first dose of either Pfizer or Moderna, and you do have this anaphylactic reaction, which, by the way, is very uncommon. So I'm talking about the, 0.0001% or whatever. That is a reason to not get the second dose. And then the other thing that just came out on the CDC is if you've had an allergic reaction to PEG or polysorbate. So I get this question a lot because we do ask everyone, and most people say, well, I'm not even really sure what that is. So PEG is an ingredient that is in the vaccine. So if you have had an allergic reaction to this, I know that it's put into some colonoscopy preps and some other things like that. I'm assuming that you would definitely know that you've had a severe reaction to this. So these words might mean more to you. If these words don't mean much to you, then it's probably pretty safe to assume that you don't have an allergic reaction to this. But the CDC did just put this guidance out, so I have had people ask me about this. So what I also want you to understand is that anytime you go to get a vaccine, a COVID-19 vaccine, that there are safeguards in place. So we at Fauquier Health, when we vaccinate, we are prepared. We're prepared for you to come. We are always going to have what we need on site. We are going to have crash cart. We're going to have an EpiPen. We're going to have registered nurses. We call, a rapid response team to come if someone has a reaction. We actually kind of created a rapid response room in our vaccine area, so that if you were to experience a severe allergic reaction, that you would get rapid care. If you get a vaccine at a different site, they're going to have a similar setup. So just want to make sure that you know that anybody that's a vaccine clinic is going to have these safeguards in place. Once again, this is from the CDC website. So CDC is monitoring reports of severe allergic reactions. And this is where Gary kind of mentioned, and I wanted to speak about the V-Safe as well. So anytime someone has a severe allergic reaction, which we talked about would be an anaphylactic reaction, airway is compromised is what we're looking at, we're going to send a report to the Vaccine Adverse Event Reporting System. It's called VAERS, the nickname, or the mnemonic. So VAERS is the national system that collects reports from healthcare professionals, vaccine manufacturers, and the public about adverse events that happen after the vaccination. So one of the things that we do with every single person that we vaccinate is we give them a form and we encourage them, and we try to go ahead and get them set up with this before they leave us while we're monitoring them for the minimum of 15 minutes. It's a V-Safe. It's an after-vaccination health check. So you have to have a smartphone to do this. Basically, there's a code. You're going to scan the code. It's going to link you straight to CDC. You're going to register. You're going to put in your name, your date of birth, and then it's going to ask you what were you vaccinated and with which vaccine. So you'll need to pick Pfizer or Moderna. You'll get a text message every day for about a week after you get your first vaccine checking on you. This is where you're going to report any side effects, any adverse reactions, those kind of things. If there's something that CDC sees that is not in the norm, is not what they were expecting, someone from CDC will contact you to get further information. The other really great thing about this V-Safe is it also will remind you of your upcoming appointment, whether it be 21 days or 28 days. So it's just a really nice program to really kind of be able to report your side effects, give CDC clinical data that they need, and also have a reminder for your follow-up appointment. So the benefits of the vaccination, some of this probably sounds redundant, but as Chad mentioned, we have seen a lot of really sick patients, and as you know, a lot of patients across the country, not just here, don't have good outcomes. So getting a vaccine helps you to avoid serious life-threatening complications associated with COVID-19. Getting this vaccine is an effective means of developing an antibody response without you actually contracting COVID-19. Based on previous vaccines, the COVID-19 vaccine may help you from getting seriously ill if you do contract COVID-19. And even if you've had COVID-19 in the past, let's say, last April, March, any month, you tested positive for COVID, we just don't know how long that immunity is going to last. We estimate 90 days. We're just not really sure. So even if you've had COVID-19 in the past, it is still recommended that you get the vaccine as long as you're not actively contagious with COVID-19. And then the biggest point I think that we can all relate to is getting everyone vaccinated will help bring a close to the ongoing pandemic. This has been by far the only glimmer of hope that most of us healthcare workers have seen. This vaccine is the very little light that we're seeing at the end of the tunnel. So that's why we're so excited about this vaccine. This is why we want everyone to be educated about this vaccine, and we want as many people to get us vaccinated as soon as possible. So post-vaccination expectations. While the vaccines are proven to be way more effective than we originally thought when they started the clinical trials, we're around 95% effectiveness, they're still not 100%. So even if you get your vaccine, you still need to wear a mask, you still need to wash your hands, you still need to practice social distancing. I also just want to make sure you understand that between your first dose and your second dose, you can still become COVID positive. After your second dose, it still takes about 14 days before you get to that 95% effectiveness that you're looking for. So just please, if you don't let your guard down just because you did get vaccinated, you still have to continue all the other measures that are in place that we know are helping. So I'd like to leave you with something. Someone yesterday forwarded me this article, and it was probably the brightest point of my day yesterday, and so I thought I would share it with you. So as a healthcare worker, been going on this, 10 months, we're all exhausted, as is everyone. This pandemic has affected every single person in this country. There's not a person I haven't met that hasn't been affected in some way. But I wanted to read something to you. So the title of this article was, Healthcare Workers Experience COVID Vaccine Side Effects. And then it says hope. Hope was the side effect that was more common than injection site pain or headache. The most common side effect or adverse reaction healthcare workers are experiencing after the first dose of the COVID-19 vaccine is hope. Quote, the Vaccine Adverse Event Reporting System, VAERS, has been overwhelmed by thousands of reports from emergency medical technicians, doctors, nurses, nurse practitioners, physician assistants, pharmacists, and other healthcare personnel who are experiencing unfamiliar new symptoms such as hope, relief, and optimism, explained Cassie Barnes, a CDC spokesman. Cassie goes on to say, these symptoms have not been seen since the start of the coronavirus pandemic, so it is indeed alarming. We need to be cautious and methodical as we process this data and continue to encourage everyone to report these issues as they arrive. So based on a poll of 5,000 healthcare workers who have already received their first vaccine dose, hope was more common than injection site pain, headache, or fatigue. In a joint statement this past Wednesday, the CDC and FDA reminded vaccinated healthcare workers that if they develop sudden onset of positivity or an acute facial contortion known as a smile, they should seek medical attention immediately. So this really brought a smile to my face and has really helped me remember that we're all in this together, and this is our hope. This is our best hope. So I would like to encourage everyone to get on that CDC website, get on the VDH website, educate yourself, and please get vaccinated. Thank you for your time, and I'll turn it back over to you, Sarah.
Wow, that was great. Thank you so much, Amy and Gary, for popping on to say those remarks. I know I can't agree with that more. I know that we all just confirming, I'm not sure if everybody heard that, but I just kind of wanted to reiterate that we're really excited to be able to share this information with you. That newfound hope, as Amy was mentioning, it's really important. A big part of making our community healthier again is kind of getting back to that new normal state, and we definitely are all in this together. So at this time, I would like to move on and show you all a presentation that we received. Our infectious disease Dr. Tam Lee with Fauquier Health Physician Services. She was not able to join us today. However, she did send over a presentation that she wanted us to share with you all. So I would like to ask that we go ahead and play that and enjoy our presentation.
I just wanted to reiterate the importance of us considering getting the vaccine for COVID-19. The vaccine is safe and effective. So for those who are still concerned about the vaccine, I would urge you to look at the data and the studies that Gary alluded to. And please do not look at social media to guide you in your decision-making process. The vaccine is made up of really 4 components. So it's sugar, salt, the mRNA, and the lipid transport media. That's about it. Okay, there's no preservatives in there. It's a dead vaccine, like Gary's been saying. So it's a very safe vaccine. When you look at the data from the 2 large trials that have been done, the Pfizer and the Moderna trials, they are independent trials, but they use the same modality. They use the same technology in creating the vaccine, so the mRNA. When you look at the 2 studies, the results mirror each other at 95% efficacy. The side effect profile is similar between the 2 studies. So again, hopefully that'll help with your confidence in getting the vaccine. So on the one side, we have these 2 large studies that are showing really good efficacy and safety data. On the other hand, right now, we have a raging global pandemic with increasing cases locally and nationwide. So a lot of you work with me at the front line. You see what I see at the bedside. So this viral infection can cause a lot of harm. We know it can cause a lot of complications. Our patients come in and they can't breathe. Some of them require intubation and mechanical ventilation. And when they get on that ventilator, you know that these patients take a long time to get off of that ventilator. And some of our patients, unfortunately, have succumbed to this infection. We also know that there are long-term complications from getting this infection with lung scarring, POTS, and a lot of other cardiac complications. So it hurts me every time I see a patient admitted to the hospital with this infection. I don't want anyone here on this call to get this infection, and getting this vaccine is one of the ways that we can prevent this from happening. I'll end with this. I received my vaccine and I am doing fine. I feel fine. I am anticipating the minor side effects that can come with it, but so far I feel normal. Even if I do develop any of these side effects, I know that my immune system is revving up and responding to the vaccine, which is a good thing. And I believe in the science. Our field is deeply rooted in science. I believe in my colleagues who have worked diligently to get us this vaccine, to protect us, and to try to end this pandemic and save lives. So I hope all of you will think about the vaccine carefully and protect yourself from this ongoing disease and pandemic as we try to end it.
Great. That was a great presentation, and honestly, that kind of is a perfect segue into who we have next joining us today. We have some special guest presenters today that I would like to turn it over to. They are on the line with us from the Virginia Department of Health, from the Rappahannock-Rapidan Health District. We have April Archer and Dr. Wade Karchner, who are joining us today. So if they're on the line with us, I'd like to go ahead and request that you unmute, and I'll turn it over to you.
Yes, can you hear me?
Yes, I can hear you. How are you?
Yeah. Well, just from the health department perspective, to date, we have given over 2,000 vaccines to phase 1A and phase 1B recipients at a central location in the district through an appointment system. We will be transitioning to a larger venue next week to be able to increase our throughput. Now, obviously, Governor Northam's announcement yesterday means that many more folks are currently eligible to receive COVID-19 vaccine. And we are working on the logistics of our process. As Governor Northam said, we ask everyone to be patient as we work out the details to implement this change. We are working with all 5 of our localities, as well as private providers and pharmacies around the district, to increase our vaccine availability as soon as we possibly can, because the vaccine availability at this point in time remains a limiting factor. Vaccinations do help protect you and your loved ones, and our message is simple. Be prepared to take this important step for your health and those you love. Get the vaccine as soon as you're eligible and vaccine is available. If you're not eligible today, you will be soon. And then I'll let April chime in as well.
Thanks, Dr. Karchner. I think that you covered most of it. I think the only thing that I would add is a couple of questions have come in, and one of them has to do with private schools and childcare and when can they receive their vaccine. And they are on the list of our frontline essential workers. They're actually number 3 on that list. So those groups are eligible in Group 1B. The other question that came in has to do with sort of the ease of our website and getting through on the phone lines and trying to get information about when and where a vaccine will be available. And I'll just reiterate that the change yesterday is a very big logistical change for us, and our small but mighty staff is working very hard. I've got additional MRC volunteers in today. They are answering the phones as fast as they can. We're averaging about 500 surveys per hour, so I apologize if it's moving slow. Our systems are doing the best we can to maintain demand, and we're both here and happy to answer any questions.
Great. Thank you both. I really appreciate you taking time to join us today and kind of provide those remarks. I think it's really great to hear from you all as the experts about what's going on currently. I know things are moving at lightning speed. And I really do know that we've probably received some questions through the chat, and what we are going to do is try to go through and answer those. We will be creating a frequently asked questions document, again, that we will be publishing. So definitely keep checking back. And I would like to go ahead. It looks like we're a few minutes ahead of schedule. So I would like to go ahead and turn it back over to Mary Ann Clyde with Fauquier Chamber to kind of help close us out today.
Thank you, Sarah. I'm so glad that everybody was able to listen to these really informative comments. It was encouraging and hopeful and clear. And I just really, really thank you guys for doing this for us. I think, you know, the best thing we can all do is as soon as we qualify to get the vaccine, and that way we'll get closer and closer to getting back to normal business in our community, and everybody can get out and about, which we love to do. So thank you, Sarah, for hosting this, and to Chad for setting it up, and for Carlton and Ginger in the background there to make all the logistics work for the chamber. And just wanted to say thank you, and thank you for everyone that that joined us today.
Great. Thank you so much, Marianne. And I believe we have another guest presenter with us today. Carlton with the Chamber, I would like to turn it over to you to do that introduction.
Good afternoon, everyone. Thank you so much, Sarah. You have worked tirelessly to put this together, and we really appreciate it here. We did reach out to get some, as those of you here with the Chamber know, we are huge supporters of our first responders. I reached out, and Sheriff Moser was at another event today, and he wanted to send everyone his best, but he has sent his public information officer, Sergeant Steve Lewis, who actually has gone through the vaccination process to chat with us a little bit today. Sergeant Lewis, are you there?
Yes, sir, I am. Thank you. And thanks for having me be a part of this virtual town hall here midday here today. I did go through the first phase of the vaccination back on January 5th. The only side effect that I had from it was the sore shoulder, and that only was for about 8 to 10 hours. Then I was back to normal. But as far as any other types of side effects, I did not have any. I am scheduled for my second dose the beginning of February, so I'm looking forward to that. I believe that the COVID vaccination is a positive thing, for everyone, small businesses in the community. It'll benefit and help mitigate against this COVID-19 spread. As far as personnel here, as far as illnesses from it or side effects, I have not heard of any, and we've had the employees here that's elected to receive the vaccination, get the first phase of vaccination, and awaiting the second.
Thank you for joining us, Sergeant Lewis. April and Dr. Karchner, we have a couple of last minute questions if you're still on and available. One question was, how do we find out where and when to get the vaccine when we do qualify?
So this is April. That's a great question. One of the best ways would be to look at our Facebook page, or the Rapidan Health District Facebook page. We also put it on our website, which is rrhd.org. We have a COVID hotline. That number is 540-316-6302. And in addition, we will share any updates and information with our media outlets.
Thank you so much, April. One more here. Can a person vaccinated still be a carrier?
So that is a great question, and we are waiting on more literature to come out from the studies. When they did the initial vaccine studies, they were looking for cases of acute illness, and unless they swabbed every person, it's hard to know if someone vaccinated could still transiently carry the organism. So more information to come on that, and that's why in the interim, we ask everyone to continue to wear their mask, watch their distance, and wash their hands.
April, thank you so much. I know you guys many times get left out of the thanks for this, but I understand how difficult a time and being able to respond to all of these things. I will tell people, April has always been great to respond to questions here at the Chamber when we had event issues as well. So I want to thank you both for all that you're doing for our community. That about wraps up our presentation for today. Thanks again to Sarah and Chad for allowing us to do this. And thank you for all your support. And if you guys have any further questions, you are welcome to send an email over here to us at the Chamber at events@fauquierchamber.org. Thanks again, Sarah, and I hope everyone has a great weekend.
Thank you so much. We really appreciate the opportunity to partner up with you guys. Thank you.